He said, I love you the way you are, honey, don't do it.
Yes, I did.
Probably should have listened to him. How long do you stay in the hospital when you have this surgical procedure?
2 hours.
And how long is the discomfort period afterwards?
It's for about a week.
Or more?
Or more.
Well, in this case, Your Honor, it's for ever since it's happened. She's not able to even look at herself in the mirror. I have to deal with that.
Well, I don't quite understand because according to the complaint, your complaint against Dr. Cole is that your breasts are a different size.
Correct, they're uneven.
Uneven.
We paid the money that we paid for them to be even. They were even the
I
first
wouldn't have
time.
listened to me. At my age, I don't look so closely anymore. Even, uneven, I'm just happy that I have them, that's it.
Well, Your Honor, if I may.
Yes.
The first time she had it done, they were even. They were balanced out. We informed Dr. Cole and we gave him the procedure that had been done the first time and explained to him that they were uneven and that the first doctor had compensated for the fact that they were uneven. He explained to us that he understood and that he would make the proper adjustment to make them come out even, which he did not.
Dr. Cole, I'll hear you, sir.
When the couple came to me, the chief complaint here was that they did not like the first surgeon's work at all. She complains, and I have pictures to show, that the nipples pointed towards the axilla or the armpits bilaterally.
Did you complain about that?
No, he showed that to me, but I hadn't noticed.
You hadn't noticed it.
I mean, it was the way I was.
Go ahead.
She had a large retraction pocket with a muscle pulling in on the right side particularly. The breasts weren't round or smooth. They were irregularly shaped where the type of implants that were placed were adhesed to the capsules.
I don't understand all that. Does that mean they didn't look nice?
They didn't look nice.
Okay.
The chief complaint they had at that time was the shape. They did not like the shape of the breast. They didn't think it was normal or natural, and there was a lot of discomfort, particularly on the right side. The second thing...
You said that you had gone back to the other doctor because you'd had some discomfort.
I had pulled a muscle.
Just a second. Look at me. Did you complain that you had discomfort to Dr. Cole?
That I had... No.
Discomfort?
No, he's not the one that I went back to. I went back to the original one.
I know that. When you went to see Dr. Cole, did you tell him that you had discomfort?
I had pain.
Pain. All right, you told him that you had pain on one side of your breast?
No, I had pain from the incisions, not pain from...
What difference does it make whether it's pain from the incision from the surgery or pain from the implant? It's the same thing. You had pain in your breast, madam. Do you understand what I'm saying to you?
I understand.
Go ahead, Dr. Cole.
The second thing they said was they'd like to have the breast enlarged if possible. The third thing I garnished not from them, but from the records they had given me from the first surgery, that there was some inequality between the breast sizes. The doctor had estimated that the difference between the two breasts was around 25 cc's difference, which is less than 2 tablespoons. But I said, if that's the third thing in terms of your interest, I will try to get that as close as possible. When I did the surgical procedure, I had a difficult time getting the capsules, the shape of the breasts, and I spent most of my time working on that so they'd be round and smooth, the nipples would point forward. The second amount of time I tried to do was to get the implant of largest size that I could in. And I explained this to Lucio's time and time again, that I could only get the size implant in that I could get in. I could not get more stuff in the area if it would not go. And I fill the implants till they're completely full and as much size as... I do not have any prior conceived notion about implant size. They cost the same to me. There's no more problem getting them in if they're bigger. I had no axe to grind as far as I put the largest ones that would fit in her body safely and still be able to close the muscle tissue.